Mental health is a crucial aspect of life. According to the World Health Organization, it's not just the absence of mental illnesses, but also the foundation for overall well-being and effective functioning. It includes mental well-being, the prevention of mental disorders, treatment, and rehab. In India, the situation is dire when it comes to mental health, with even the former President Ramnath Kovind highlighting in 2017 that the country is facing a potential mental health epidemic. The statistics are indeed alarming. India has among the highest prevalence of mental illnesses globally, with the number of Indians suffering from mental health issues exceeding the entire population of Japan. 1 in 20 Indians suffer from depression, and nearly 15% of Indian adults need active intervention for one or more mental health issues. 60 to 70 million people in India suffer from common and severe mental disorders. Depressive disorders is one of the most common amongst mental health issues in the country, cutting across age, gender, socio-economic background, with the country also experiencing increasing rates of suicide. In 2022, the suicide rate rose to 12.4 per 100,000 people, the highest since 1967, with India reporting the highest numbers of suicides globally that year. The young, the elderly, and those in urban settings are expected to be the most vulnerable to mental health issues in the country. The biggest obstacles we face when it comes to mental health are stigma and denial, with issues often ignored, not discussed, or self-diagnosed. Statistics show 90% of Indians simply don't receive mental health care. Financial barriers and a severe shortage of mental health professionals worsens the problem. For every 100,000 people, there are only about 0.3 psychiatrists, 0.07 psychologists, and 0.07 social workers. To put it simply, in a large stadium filled with 100,000 people, there would just be 1/3 of a psychiatrist and less than 1/10 of a psychologist and social worker each. This means mental health services are extremely limited, and many people may not get the help that they need. Let's delve into mental health with our top experts on the show today, Dr. Samir Parikh, Dr. Seeba Anam, and Dr. Nirmee Shah. As the saying goes, there is no physical health without mental health. Well, Dr. Shah, let's start with you. Can you explain why India has such poor mental health and such high rates of depression?
So as you already pointed out, access to mental health is quite poor in India. We have very few trained psychiatrists, psychologists, and other mental health workers in our country. This means that access is limited, and also the cost of accessing that mental health is very high. So people from low socio-economic or middle income groups will find it that much harder to access mental health when they actually need it.
Okay. Well, Dr. Parikh, I wanted to come to you. How does stigma and denial impact the mental health landscape in the country?
Just focus on stigma. What does stigma mean? Stigma means that people around me don't see that I am having an illness. They see I have some problem which is because of me, as though I have a choice. Second, this stigma makes me feel, if I had a mental illness, that I will be discriminated against. Because of this, I won't tell my employer, I won't tell my friends, I won't tell my family, and I'll avoid taking treatment. There is robust evidence. If treatment is given at the earliest of symptom onset, the recovery rates, the prognosis in most mental illnesses is very good. The problem is the stigma prevents help-seeking behavior. Delayed help-seeking behavior starts a vicious cycle of quality of life being impacted for the individual and the families.
Okay. But what then do you tell the families when it comes to stigma and denial?
You tell them that it's an illness. I mean, you don't blame somebody with diabetes that why is your insulin not functioning fine? You didn't tell somebody for COVID that why are you having fever. You don't tell a patient with typhoid you shouldn't be having this symptom or that symptom. You take them to help. You don't tell a cardiac patient that why are you having a blockage in your heart, you should do something about it, it's your weakness. We don't do that. Whether it is insurance, whether it is leaves, whether it is support, when it comes to most physical ailments, we have very clearer systems available which we are accessing. Whether it is for, let's say, a school going child or a working adult for an elderly. But when it comes to mental ailments, somehow we first think, what did you not do right? Why don't you avoid this? In fact, don't take medications. There is a whole lot of stigma around medications. You will also think about that, no, don't go for therapy. Why can't you talk to a family member? Why can't you talk to a friend? But you don't say that for other medical ailments.
Okay, but statistics, like I pointed out earlier, show that the young and those in urban settings seem to be quite vulnerable when it comes to mental health issues. Why is that?
I think the stressors that people face in the urban settings, and also the young people, the kind of competitive atmosphere that they are finding themselves in is like never before. We don't talk about mental health as a society. It's not given much importance in our education system as well. So people feel that they're not equipped enough, and therefore this particular two groups are the ones that are most vulnerable at the moment.
Okay. Has there been an incremental rise or a rise in the past decade odd, or is it because more people are comfortable with coming out with their problems?
I think it's both. People are now more aware that this is mental health, and therefore we should come and speak to somebody and get help. And also stressors have increased, financial stresses, we've had the COVID-19 pandemic. So these kinds of stressors have happened more recently, which means more and more people are struggling with their mental health. So it's a bit of both, I believe.
Okay. Well, with regards to the elderly, that's also a section which does see a lot of mental health issues. What contributes to mental health issues in the elderly, and how does one tackle them effectively?
Sure. So there are multiple factors. So the age itself it means that the people may feel less resilient than they did before. Illness, so chronic health conditions or any kind of acute illness in the elderly population means their mental health can be affected. It could be financial strain that tends to happen in the elderly, particularly if they are having health issues. Also, we are moving towards more nuclear families, so the lack of support is another big factor in the elderly age group, where they are finding that they have to lead more independent lives without enough support. There are a lot of people in India, elderly people whose children are living abroad, working abroad, and they are on their own over here. So that has become an issue in the elderly population as well. Also, the elderly are coming forward also now, because they, the awareness is improving, but we're still, there's a lot of distance to cover.
But what are the problems that they most commonly present with?
It could be changes in their mood, so depressive symptoms like mood changes, lack of enjoyment in what they're doing. They may present with trouble sleeping. A lot of them can feel very overwhelmed and anxious. They feel that they cannot cope with what, it could be simple household chores. They may not be able to accept that they're becoming increasingly dependent on other people for help. That may be a problem. It could also be behavior changes where they are isolating themselves, withdrawing from people, reducing social connectivity may be a factor. And some people also have very morbid suicidal thoughts that can affect them. Another important thing to consider in the elderly population are memory changes and cognitive changes. So things like dementia, this is also something that people are not much aware of.
So what do you recommend? How does one tackle this?
I think recognizing that something is off in the way they're feeling or in the way they're managing their emotions, and getting first, the first step would be to talk to somebody they trust. It could be a friend or a family member, and then the next step is to get the professional help. So making this conversation around mental health something in our family, within friends, something, look around yourself also to see if you can identify somebody who's struggling with their emotions, or you notice that they're not picking up your calls, or that, they are distancing themselves, they're not attending social gatherings like this, like they did before. Reach out to them, ask for help. encourage more and more people to come forward and seek help.
Okay. Well, Dr. Parikh, what are the signs that one should probably notice or be aware of when it comes to mental health?
If you feel there is a change in mood, which means mood going low or maybe irritable, change happening in behavior, change happening in my social engagement, change happening at my performance level, which could be my occupation, my academics, or my day to day, change happening in the way I look at my own self. And if this is happening, let's say for a continuous period, 2 weeks or so, and it's giving me in a negative impact on my functionality, my overall functioning is coming down for because of any one of these things, almost in a consistent manner, this could be possibly a mental ailment, and I need to see someone. Let's also be very clear. You were right that we have a deficit of experts. So, over expertization is also not a solution. We need to encourage people to go to the family physician, general physician. I believe way forward is utilizing the digital innovations, whether it is digital telemental health or whether it is using and bringing AI in mental health, because you will need to create more and more layers so that more people can get access at the earliest in the most cost effective manner, so that you can also figure out the way to navigate around the dearth of experts.
Okay. All right. So what are the strategies that you would recommend to cope with mental health issues? Not every mental health issue is probably, probably warrants seeing a doctor right away. It's probably, being healthy when it comes to your mental health as well. So what are the strategies that you would recommend, Dr. Parikh, to somebody watching this show?
I mean, I'll split this in two parts. I'll split that what we can do at a collective level and what we can do individual. Collective, let's start from children. Mental health curriculum in schools, psychological first aid both in schools and workplaces becoming almost a part of who we are. And in schools, working on bullying and media literacy. You move forward, you start working on skill building throughout here so that people are able to deal with stresses of life, so that they don't need to seek help every time they are struggling, and they need help only when they truly need it. And then you create a layer of, like I mentioned, AI and primary physicians, making digital mental health available so that you bring the cost down as much as you can. And then you integrate it both at primary, secondary, and tertiary level. Also, a lot of times we forget that comorbidity is high. So you may be having cardiac, diabetic, onco-related problems, but they also come with mental health issues. And if they aren't addressed, then the prognosis is affected. At the other side, what can we all do? I think we'll all need to understand that we'll have to bring a level of mindfulness of urban living, especially. There is a bit of a hustle, there is a bit of a rush that we are all in. Most of us don't find time for our own selves. Most of us don't invest in relationships. Social media followers and likes and views really don't quite matter as much as meaningful relationship. I mean, the most established happiness. The study what brings happiness is meaningful relationships. So invest in relationships, physical activity, a lot of me time, being able to take breaks, balancing life, doing things that you believe in, like and enjoy, and never hesitate to seek help. Now, that's something, if we start doing it and balance this, we'll be able to do the best that we can. At the same time, in spite of doing everything, I may still get an ailment. If I get one, go ahead, seek help, don't hesitate.
Okay, all right. On that note, we're going to take a short break. We'll be back with more questions. Stay tuned.